I'm Liz Larson.
And I'm Bill McKenna.
And together, we created the Cognomovement system. And we'd like to welcome you to the New Life Perspectives radio show,
where we're going to be sharing with you tools, tips, and ideas that are going to change your life.
Hello in UK Health Radio Land. I'm Liz Larson with New Life Perspectives radio show and one half of the Cognomovement team. Bill might be joining us a little bit later, but today I have the great pleasure of being here with someone I call a very dear friend and an amazing practitioner, doctor. I'm here with Deanna Elliot from Centered Physical Therapy. Deanna is a doctor of physical therapy and functional medicine. So welcome, Deanna.
Thank you. I'm excited to be here.
Yeah, I'm so happy to have this conversation with you. We had to wait because Deanna is a brand new mom for the third time. And that's going to be a big part of our discussion today. So as a doctor of physical therapy and functional medicine, Deanna focuses on pregnancy, before, during, and after. So Deanna, tell us your background a little bit. And then would you please tell us your very unique birth story?
Yes. Okay. So I am a doctor of physical therapy. I am going on 11 years of being a physical therapist. About 5 years ago, I kind of branched out away from the traditional physical therapy realm to encompass more of a holistic way of treating the body. It's more fulfilling for me, but it's also more satisfying for my clients because we can actually get down to the root of the problem. About 3 years ago, that's when I added the functional medicine aspect to my practice because it was just one more thing. Everyone was always complaining about joint pain, gut issues, anxiety. A lot of that stuff can be resolved through some of the breathing techniques and the postural restoration techniques that I utilize, but the root of the problem really came down to the gut health. And that's where I started to add that. Around the 3-year mark is where my second baby was born. So I'm one of those crazy ladies who made the transition when I was, third trimester, getting ready to, I was fed up with the current system I was in, and I really wanted to do something better for myself. And I wanted to cut out a lot of the stress. So I got out of the kind of the 8 to 5 and really started to build my own practice. And that allowed my body to start to heal. And then that's when I really added this additional training of the functional medicine. And I was able to really get down to the genetic and the gut health and the digestion component of my body. And so I have 3 girls, 6, 3, and 2 months. And I've struggled with kind of the traditional model myself. In my finished PT school and in my mid-30s, I gained a lot of weight. The OBs told me I was eating out too much, which I wasn't, but they just assumed that I was gaining too much weight. They put kind of a fear factor in my head about how much weight I was actually gaining. And then I had to immediately go back to work 6 weeks after I had her, which added another realm of stress into, giving all of my energy to my full 20 client patient load. And then I wasn't comfortable. I wasn't sleeping good. I was stressed out to the max. That's when my husband and I ended up moving to Oregon. And I started doing home health, which opened up a little bit more of my free time. And then that was when I can kind of transition into building my own practice. So I have struggled with infertility issues. I had 3 miscarriages over my lifetime in between the girls. And I'm just super passionate about how poorly women are treated in the whole pregnancy realm. We put a lot of effort into the child, into the baby, but we don't feel anything into the woman. And that's really a huge mistake. We get a lot of our gut microbiome from our mom, and how we can manage stress actually depends on how our mom manages stress inside the womb. So like we essentially get set up to fail with all of these cumulative stressors before we even enter the world. So my first baby, 24 hours, like 2 hours of pushing. I didn't tear on any of them, but she really hurt my hips, low back. I was inflamed. My downstairs was not good. And I couldn't poop normal. And that's kind of a thing that no one talks about. But I asked my OB, you know, hey, when's the next time I get to have a satisfying poop? And he said, oh, I've never heard of it that way, but you could be upwards of a year. And I was looking at him like, is that standard practice? You have a baby and then you can't, you know, have a normal functioning body for up to a year. So that's kind of when my journey began with the PRI stuff. And the PRI is a postural restoration institute, and it's in Lincoln, Nebraska. And I have been doing that for, 6.5 years now. And it totally changed my life physically. So my body was hurting. I used to be super active, couldn't do the normal hikes, couldn't do the, I couldn't do the normal things I wanted to do. It was always so painful. I was able to restore some balance through the PRI stuff. And then I felt more balanced and more resilient through my hips and my lower back. After Madison, I ended up having 2 miscarriages. And the doctors just told me that it was just part of, like, they couldn't put a pinpoint onto it, but I was stressed out because this OB told me I gained too much weight. So I was trying to exercise. I was working. I was staying up late because the baby wasn't sleeping. It was a stress after stress after stress. So that's when I started to dive into the alternative medicine, and then got onto the supplement bandwagon and really diving in that way. But then I kind of got hooked into, that supplement trap where you're just kind of guessing. And it wasn't until Olivia that it was like my rock bottom. I ended up getting pregnant 3 years after Madison, and she was a total different pregnancy. I ended up not going to see an OB. I hired a midwife, and we ended up really getting down to like the emotional support. And that birth was 3 hours start to finish. And I was still having some gut issues and some joint pain, but like significantly reduced, probably about half. And then it wasn't until, like, I always knew I wanted 3 kids, and my husband was like, okay, we could try for another, and we ended up planning it out. So my goal was to heal my body and create the best pregnancy I could, not just the physical aspect. So this is where I really dove into the functional medicine. I got stool tests. I identified my digestive issues. I identified my DNA issues, my nutrient deficient issues. I don't absorb vitamin D. My vitamin D level was too low. I don't have enough choline in my body. I can't absorb it. My switches for inflammation at a genetic level are turned on. And so I just had to combat that aspect of my root problems in order to maximize my feeling. And then I remember I was working all the way up until basically Jordan was born, and people are like, oh, you have such a physical job. How are you doing this? Like, how are you feeling? I'm like, oh yeah, I forgot. For a second, I forgot that I was pregnant, because I literally have 0 pain. I'm sleeping well. I set up my body to gain the momentum of upstream medicine so that I can kind of remove each layer. And that's just the physical and kind of the gut health stuff that I incorporated. I did incorporate a lot of the Cogno movement, really unwinding more of my mental and psychology aspect of my trauma and my, just stressors over a lifetime, just little things that you don't really think.
So let's break this down for a sec for everyone. So I met you between Olivia and Jordan. So that's your second baby and your third. And you were embarking on this journey. But when we first talked, you really blew my mind about what is available, what are the possibilities for women before, during, and after, but also some of the social norms that we think are just expected. And you kind of touched on them with your own story, but some of those are like the pregnancy's out of your control. Like it's just, a crapshoot. Whatever happens, happens. That it has to be really scary. It's this big medical emergency that you have to be in pain, that waddling and that hip spread is normal. Talk to us a little bit about the social norms and how can a woman before, during, or after, how can she challenge those even with her doctor?
Yeah, so this is a tough one, and this is one that I'm really passionate about, but you have to be your own advocate, which is kind of sad, right? You hire a professional and you think that they're in your corner, but sometimes they're not, or sometimes they're looking for the quick fix. So there are things women are told, for example, the stress, the waddle, like I won't poop normal for a year, I'm going to have problems with intimacy after, I have a fear of my uterus falling out. Like our society is like, it puts us in, we seek out that fear factor information, when really the only portion, honestly, in a pregnancy that you should feel out of control is when your body is pushed to the end during labor, but you're really not out of control. You just shifted into a natural ability of what you're like, you give into your body's a natural ability to give birth. It's those social norms that kind of put like a ceiling on us and don't allow us to recognize, like, I don't want to give someone information about, hey, don't waddle, or hey, I don't want you to be scared, but like, I need you to recognize where you are, and then you can make a change from there. So a lot of the stuff that I do, and there's a lot of practitioners around the world with the postural restoration certified. So I'm a certified practitioner, and you can essentially unwind your body to create more natural flow, natural balance, because to counteract the growing baby. So your body is kind of gonna, arch forward and create space for this baby to grow in your belly, right? But the rest of your body has to take up either grip muscle, or you have to put an extra load on your bones or your pelvic floor, your bottom. And over 9 months, that can add up. And then you add baby number 1, baby number 2, baby number 3. If you never reset back to baseline, that's the problem. I feel like we don't reset to baseline and then go forward again. It's just like, hey, it's like that weight thing. You gain 10 pounds. I'm never able to lose that last like 3 or 4. Right. And then it just adds on, it just builds.
Right. We're told that your baby's just going to destroy your body and you have to deal with that. And if you could have seen Deanna during this pregnancy, I got to, and if you saw her from behind, even, right there at the 9th month, you would not have known she was pregnant. The baby, the rest of her body looked very, very normal. In fact, we saw her just days before the baby was born because my husband threw his back out. And so she said, yeah, come on into the office. And she was jumping up and down, not jumping, but popping up and down off of the table to show him what to do. You would have never guessed. And I saw the pictures of her in the 2 pregnancies before, and it was a completely different situation. She looked like your typical pregnant woman, with the swollen mouth and the, heavy body and the wide hips and all of that, right? So I think that's what is so amazing that people can understand, is that you do have an option. And you said the word unwind. You can actually take steps to put your body back to normal. A lot of the things, if you see Deanna, if you speak with her, the first thing she's doing is assessing. It's a lot like what I do when we're watching what people look like, their neurology, but assessing this forward tipped hip movement, where the belly's out, the chest is up. And, that's what happens to us when we have babies. There's this big forward kind of opening. And with your postural restoration, you reconstruct, you get the body. You're always talking about the head being back on top of the body, not jutted out, right? The ribs down. So talk to us a little bit about that piece, the PRI part, and how it is actually possible to get your body back in alignment.
Yeah. So a lot of people think about posture as like, hey, let me squeeze my shoulder blades together and sit up straight. It's more than that. So the Postural Restoration Institute is really focused on pressure and understanding your perception of where you are in space. So basically, you have a set amount of volume inside of your body. I'm going to go into your abdomen, so like your stomach, where the baby would live. You have a domed diaphragm on the top, and then you have your pelvic floor bowl muscles on the bottom. So it kind of creates like an egg shape to kind of house that baby. As we add stress, if we've had a cumulative stress, like for example, for me, like I went to PT school, I moved away from my house, I got a new job, I was away from my mom, and then I found out I was pregnant, and the OB was telling me I was fat. Like all of these assaults over time, I was essentially holding my breath. Okay, so we're humans, we breathe 30,000 times a day. Who says that we actually do it correctly, right? We can be proactive about our breath, and we can create efficiency within our body, and our diaphragm and our pelvic floor create that house for that baby. But more than that, we can actually optimize our pressure so that we can become more efficient. I think naturally we only use like 15 or 20% of our diaphragm. And a lot of like pulmonologists don't think that you can actually make a change with the diaphragm, like the doming of the diaphragm. It's like a parachute coming up, and like you're flattening it out like a pancake as you inhale. So you inhale, parachute up, exhale, parachute up, inhale, flatten out. And you can actually create more, you can shift your volume and your pressure over a better base. And at this point, I would say your base for the topic of discussion here is your pelvis. So then your baby feels safe. So it's, yes, we breathe 30,000 times a day, but if we don't know where we are, our bones are going to start shifting and molding. Then we get tight muscles, then we get tension headaches, then we get tension in our shoulders, then we get, an ab separation, you're doming in the front of your belly, or even worse, you have a hard time pushing out the baby because the OB tells you that your baby's too big. And that's a whole nother conversation, but basically you can reorganize how your actual skeletal muscle, like your bones, are positioned and stacked so that you can move pressure and shift and alternate. It's almost like you're building a foundation. If I build, Ron used this analogy. He's my mentor at the Institute, but if you build a 60-foot building, are you going to do, a 20-foot slab of concrete underneath for the like thickness wide for the foundation? Or are you going to go more upwards of like 60 feet wide so that you have a big base and your body knows where it is before you start building up? And we're built to extend. We come out of the womb and we're all folded up little, crunched little baby, elbows, knees to our chest. But as our body develops, we start extending and standing up. We have vision that acclimates us to the horizon, and then we only put 2 feet on the ground. Now we create habits and lifestyle patterns and hobbies that facilitate kind of poor posture, but more so poor pressure regulation. And then it puts more demand on other joints above or below that pressure.
I think this is kind of amazing thing. If everybody could get this one takeaway, there's so many of the things to take away that Deanna has to say, but just this one, that you don't think physical therapy for pregnancy at all. No one ever thinks that. And oh my gosh, is it huge? Secondly, people don't think this kind of physical therapy. Before I met you, I thought physical therapy was you go in, they put you on a machine and you do reps, a lot like going to the gym. And this is not that at all. It's very targeted movements combined with breath that train your body how to reshape. I think that's the most important thing, that a person can understand, that your body literally reshapes itself. We've been talking about this a lot lately because we're working on a little program together where a woman can change the shape of her body and look like she's lost a lot of weight. And in fact, her body does, because it's no longer in that fight or flight stress shape, right? The trigger, the signal in the physiology changes when that posture changes. So tell us a little bit about that, how this reshaping that you're talking about actually happens and why it helps so much in, getting the body out of that stress state.
Yeah. So the diaphragm, going back to that, your diaphragm lives kind of right underneath your rib cage. So if you can imagine, like if you looked at a body, you can see your rib cage is kind of domed up. Right underneath that rib cage is where your diaphragm lives. So we have a tendency, and our bodies naturally have a tendency to kind of take the path of least resistance. So we're going to be, we're going to find the easy path. We're not going to, if something hurts, we're not going to do it unless we know the benefit of the outcome, right? If it's uncomfortable, we're not going to push through uncomfortable unless we have to, or we see where we're going, or it makes sense. So our body, when we take a breath in, we can essentially, if you sit here and you're listening to this right now, take a big breath in, you can feel your chest and belly kind of come forward and your back arches. But can you do that? Can you take an inhale without letting your body move? More so, let's put the air kind of in your bra line or the back of your rib cage. So if you take a breath in, can you take a breath into like the back of your shoulders, back of your neck, back of your bra line is the reference that I usually use. Most people, even including guys, get that reference. So we have a tendency to overextend and create that over postured forward momentum. Now we have to use muscles on the back side to really anchor us down so we don't fall forward. If you can think of it as like, I always use the analogy of a Pringles can. So the diaphragm and the pelvic floor, it's a closed container like a Pringles can, right? So if I ended up getting a Pringles can that was fairly dented on the sides, what I'm trying to do with your breath is kind of restore and pop out those dents so that you can have more balance to shift and alternate side to side, forward and back. So you reshape your body by going through the uncomfortable gangs. So I like to let's say hello to the pain. And usually this is where I work with Liz a lot. So if I have a patient who's had, right neck pain, right shoulder pain, kind of like tension in this right under her clavicle situation, that's where a lot of trauma emotionally hangs out. So if it's scary, like we need to recognize there's a problem, recognize, hey, let's compare to the other side. We should be able to do both things on both sides, but we need to recognize and say hello and give it a name, just recognize that it's there, and then understand that we need to come over onto the other side. And that may take some time. And this is where I really, I can help reshape the body as long as the mind is willing to come with it. And that's where the Cogno movement, I feel like, comes in, because you can delete a lot of the trauma aspect, and then it makes my job a little easier to open up said joint areas, and then restore that flow and balance, because the body will shut down what is scary or shut down what you're trying not to feel.
Yeah, I mean, it's so true. Like, that's where we really share that language, is that the body's really trying to keep you safe. The nervous system's constantly trying to keep you safe and alive, but it gets these weird patterns that will hold you out of alignment. And that's what you see a lot in your office. And if we can get that nervous system to shut off the fight or flight, it happens on your end and it happens on my end. It's a really interesting pairing. I actually work with 3 physical therapists for this exact reason, that people come when they get to a place where they can't get it to move on your end. They come to me, we delete that pattern out of the nervous system, and they come back. And now the body's totally willing to accept the changes. So I think that's a really important part. And I want to move that over into the birthing process. We worked together on that, but we talked about this a lot, about how much fear there is in pregnancy, birth, and after. In my case, I was a terrible pregnant person, but it was not the birth, not the pregnancy, it was the after. What was going to happen in my life, when a new baby came and wreaked havoc on my career or my body, right? If I had Cogno movement way back then, 1,000 years ago, and been able to delete that fear out of my body, one, I would have enjoyed pregnancy and childbirth so much more. But instead, it was just a train wreck, right? So talk a little bit about that, what you see in the fear part, and how are practitioners kind of inadvertently contributing to that?
Yeah. So I feel like our bodies in general, like, we attract what we already have inside of our body. So it's almost like a competition comparison game, when really we just need to recognize, like, whatever your journey is, if you want to have a natural birth, if you want to have a C-section, if it happens to have a C-section, if if you're on baby number 1, baby number 2, baby number 3, if you're a working mom, if you're not, like, we have a hard time not comparing ourselves, so I think the postural restoration and the Cogno movement together literally help you find balance, so that you can lower the threshold of physical, emotional, hormonal stress. It helps you detoxify out your internal stressors. So unfortunately, I hear that all the time, hey, my sister did this. It was like, 50 hours of birth and I had to push 4 hours, and, now I have a grade 3 tear. But then you go back for your 6-week checkup, and, oh, you're cleared for intimacy, you're cleared for exercise, but you have questions about bleeding. They don't really have an answer, like, it's just, I don't think the follow-up care is set up to put a woman in a successful mind space, in a successful physical space. And in every other country except for the US, like, you have a baby, here's your prescription for a pelvic floor PT, period.
Really?
They don't do that in the US for some reason, which is mind-blowing and infuriating to me. So it's just like, hey, let's just pop out this baby and then go back. Oh, when are you going to go back to work? Oh, when do I need to do this? Oh, I need to also add all my kids into all of these activities. So I think that we almost crave it. as a society, but I know a lot of practitioners that are trying to change the verbiage. So I think it's good to not just ignore the fact that you're scared, anxious, have fear, have had trauma in the past. I think it's important to find someone who can listen to you, because that's the only way that first the body can begin to heal, is if you actually feel like you've been heard, then you can start, lowering your defense system. And second, it's like, it doesn't really matter. Like, what are your expectations? Sometimes we put our expectations up too high. And then if we just need to be clear about what we want. You need to be your own advocate. That's the hardest kind of unfortunate thing about this. But, knowledge is power, and finding your team and your tribe and knowing that there are practitioners out there. And this is one of the main things that I get frustrated at. It's like, I had, when I first opened my practice, I had this lady who, she's also a therapist. She's an occupational therapist. And she came to me and she emailed me and then called me. We had a phone conversation. She did a free 30-minute assessment. And I told her what she needed to do. And she was like, well, I've done physical therapy. I've done pelvic floor PT. I've done cranial sacral. Like, she named off all the things, but I just kept telling her, it's possible that you were asking all the right questions, and you didn't find the right person that feels you, that hears you, that your nervous system felt heard, or it wasn't the right time for you to be treated at that layer of healing. So you need to know that your level of healing and your journey is different per baby, life, age, and we attract that negativity, unfortunately. But I want you to recognize it, but then also be able to, if you can't, release it and kind of reset you back to where you need to be, find someone who will hear you. And then there's practitioners of all kinds, all aspects, wherever you feel like you need to start unwinding so that we can get you back to a baseline.
So I think, something that you said really struck me when we were talking off camera is get a second opinion. So women don't do that. We find an OBGYN, we figure, this is the standard of care. We don't go out and interview multiple OBGYNs. We also don't interview midwives. I mean, that's something you and I are a big advocate of, is a midwife is going to speak to you differently than your OBGYN, right? And some people do both. So, and you can interview them. They all have different styles and techniques. Some people can have a doula. But I think one of the things that we talked about here is mental health and pregnancy. You can talk to a counselor about your pregnancy. You can find like a Cognomovement practitioner to alleviate fear and get yourself in a place where you feel really confident about your birth and comfortable in what's going to happen and work through. So I think we're at a segue where there's one more thing I want to say. There's so many things, but also I want to let people know that you can go back, even if you're an old lady like me, and actually get that care after. You can still restore the damage that was done to your body if you've never repaired it, even as an older woman, right?
Yes,
yeah,
absolutely.
So I want to encourage people to go out, like things like incontinence, other gynecological problems can actually be solved with the work that Deanna does, the PRI, that kind of thing. And no one tells us that. We think we just have to live with it. Not true. So I really want to have enough time for you to actually share what did happen with Jordan, your third baby's birth 2 months ago. This is an amazing story. And I just want to say in advance, it's not typical, but this is what did happen to Deanna.
Yeah. So building up, I would say Jordan is 3 years in the making. So I was optimizing my gut health, digestion, getting my inflammation under control, getting my body into an optimal position through the postural restoration stuff. And then I don't cycle a normal 28-day cycle. Mine was 35. So my quote unquote due date was April 20th. And April 9th. And I was overdue, and they were getting worried that I was getting too overdue, but I just felt in my body that I wasn't, I wasn't ready yet. And she wasn't, she was still happy, everything was good. But I met with Liz, was this like, I think I met with you like a month before, and then like 2 weeks before, and then the like 2 days before. I think that was the sequence.
Yeah.
And so I've had some fears on getting across town. So the birth center to where my house is located is, about like 2.5 miles. But it's across the bridge, and we have 2 littles. So I would have to coordinate like the time to get, someone to watch them, get in the car, get over there, make sure the midwife was over there. And I had a hard anxiety freak out. Like, what if I don't make it across town? I even had my husband, Google and YouTube and watch videos like how to catch a baby and like what he needs to do, because I was like, he's going to have to catch this baby in the car. Like, there's no way we're going to make it over there. So I met with Liz. I felt my body was really balanced, but so we deleted that anxiety, and then I felt good about it. And then I was like, you know what, that would be actually kind of cool if Wade caught the baby. That would be an awesome story. So like, that was happy inside my body. But then I was like, and that was the main focus of that kind of session with Liz. But then we met for lunch, and then her and I kind of banter back and forth throughout the weeks and stuff. And then she goes, hey, what if we, like, she works with Olympic athletes and like people who are trying to optimize their performance on a very specific skill. And she's like, hey, I have an idea. What if we map in this specific skill? Your body already knows how to do it, right? So why don't we map it in on how you want it to play out? And since I was like really like into how intuitive I could get with my body, I was like, okay, let's do it. So we did a whole session and we're mapping in. She's taking me through, like, she's talking to me with my uterus. So we were talking to the uterus, like, hey, this is the process. Like, it's every this is your job. And, basically mapping out what the uterus is supposed to do, start to finish. Then we were talking about the baby, and we were really talking to Jordan, and I didn't know what she was. So she was a surprise. So we were like, baby, you're going to be safe. It's okay. Like, just letting know that we were talking to her and telling her what the situation was going to be, what to expect. You're going to get squeezed through a very small canal. But when you come over onto their side, it's going to be very loving. So we felt good with those 2 things. And then I was like, well, I need a signal. Like, I'm going to wait too long to get in the car and drive. And that's when the baby's going to come in the car. And so I was like, she's like, wouldn't it be cool if we like mapped in, like, do you need a contraction, or do you need, I was like, how about I just get tight on my pelvic floor and my water breaks? So at, let's see, this was at 12:57. I had my first contraction. And then I was just laying there kind of assessing the situation, and it was kind of an intense one. And then my oldest had a nightmare, and I went into her room and she was like, no. And I was like, is everything okay? But she didn't wake up. So I almost think that she was like maybe talking to Jordan as well, or like, I don't know, just making sure everything was, she has extra powers too. So it's just funny how things worked out. So I went in there, and then I came back and laid down in bed. And then I had another contraction. Then I had to get on all fours and really get into a really stable position. And then my water broke. So the contractions were my uterus and my pelvic floor, which is what we mapped in. And then my water broke. And I was like, babe, we got to go right now. Like, this is my signal. We got to go. So, and it wasn't just like a little like trickle. It was like a boosh, like in Hollywood, if you're like sitting there, they're like drinking a soda or something on the like corner of downtown New York or something, and just the water breaks. So it was like a lot. And then my babysitter came over, watched the 2 girls. We hopped in the car. I had 2 more contractions between water breaking and getting to the car, from the car to the birth center. And then I just kept saying that I was going to get sick. And my midwife was following me around with a trash can. And then she's like, hey, let's get comfortable on the bed. I was like, nope, I got to get on all fours. And then it was pretty intense for probably about, half an hour. And then I was like, I got to change positions. And I had my husband push on my hips and really close the top portion of my pelvis so that he could give me some relief at my lower back. And then I did one push and the head was there. And then the midwife had to make sure that the umbilical cord wasn't around the neck. So she checked, and then it felt like forever for the next contraction. Boom, one more little push and she was here. And it was exactly how I wanted it to be. And funny little tidbit, the head was out and we didn't know what the baby was. And on the last push, I was like, come on, baby girl. It was like my body knew. And then my midwife hands me the baby. And then, later on, they came up to me and they were like, are you sure you didn't know what it was? Because how did you know it was a girl before she even was here? Something inside of me already knew, and it was like, I've optimized my body so much that my pregnancy was so different that I had literally no idea if it was a boy or a girl. I didn't have that sensation because I cleaned up my everything. So it was mind blowing how specific that I got. I was like, okay, I want that contraction on the pelvic floor and I want my water to break. And that's going to be my signal. Like, we need to get in the car and go right now. And boom, 64 minutes, start to finish, 2 pushes. She was here.
It's amazing that it can be like that. Your body was so ready, so prepared for the whole thing that it didn't have to be, a huge drama, which is amazing because then you and the baby are both healthy after. You're not desperately exhausted like a woman who's been in 48 hours of labor. The baby
Exactly.
wasn't in trauma. She had a few minutes of the thing and then boop, she's out, and which is possible for everyone theoretically, right? If we knew a little more, if we had these steps that you took, if every woman was empowered with cleaning up their gut health, getting their inflammation down, knowing genetically what they can eat and what they can't eat, getting the body lined up, and then mapping in your birth, getting the fear out of the way, more births could be faster and with less damage. So Deanna, we are like right up against the end of our time together. Will you come back again? Because there's so much more to talk about.
Oh yes, this is super fun. This is like one of our normal conversations on the phone.
True. So we give everybody, every week, we give everybody a little tip. We've just got 4 minutes. Would you give us a little postural tip? This is for everybody, men and women, right?
Yes, men and women.
Yeah, something they can do while they're sitting or driving, right? That's what you said?
Yeah, so we do a lot of sitting these days, and sometimes the driving gets most uncomfortable for people. So I like to bring it back down to the pelvis. So if you can sit with your feet on the ground and then your sits bones, so those bony pieces on the chair, and kind of rock back so you feel them. That's your foundation. That's where I want you to be able to stay. And then we're going to breathe from there. Okay. So our natural default setting is to kind of orient our pelvis and our lower back to the right-hand side. So if you, it's almost like we're always making a right-hand turn. So we need to be good at doing right-hand turns, but we also need to be good at doing left-hand turns. So we can drive that with our pelvis. So if you sit kind of that 90-90 position, feet on the ground, butt on the ground, knees and hips are level, rock back and find your bony pieces. You can push against the table if you want, or you can just put your hands on your knees. And I want you to inhale through your nose, pull that left knee back without moving your feet. Exhale through your mouth. At the end of the exhale, try to pause for upwards of 5 seconds. Breath in, try to stay in that position and go into the uncomfortable zone. Most likely you're feeling tightness or weakness on that left hip, outer hip, inner thigh. So you can do this when you're driving. You can throw it in cruise control, or the best is when you're parked and then your hands are on the steering wheel. You can kind of push your body into the seat so your body is molded into the seat. and then your feet are grounded, and then your inhale, pull that left knee back, let that right knee float forward. A lot of the times we like to keep our knees kind of way further wider than our hips. So grabbing a water bottle or a little ball or a sweater in between your knees will help balance that foundation. And once you start building this foundation, your body up the chain is going to kind of move that volume, move that pressure where it needs to be, so you can optimize detoxification. You can balance tension. You can offload lower back. You can offload hips. You can offload even jaw tension and head neck pain. It all comes down from starting at the bottom. So I like to do this exercise, especially if I'm in the passenger seat. I'll put my purse kind of in between my knees. I like to do this, hey, if I'm going to go from one town to the other, if I could do that for half an hour, man, you're in good shape. The focus is, can your body feel the ground and your butt? Now, can you breathe? So you need to know where you are, and you're going to go in through your nose, out through your mouth. We are mouth breathers, so we're breathing too much air through our mouth. So we need to focus on in through our nose to detoxify that air and all those chemicals coming into our body, and then exhale, get it out. We essentially get rid of 8.5 pounds of fat through our breath. The rest comes out in urine and sweat, but a lot of it comes out through breath. So we need to know where we are, and then pull that air in through our nose, and then a really long exhale.
All right. Thank you for that. So rock your hips back, push that left hip back, both feet on the ground, and breathe.
Yes.
So you may have to listen to this a couple of times to get all that, but it really does work. So we're right up against our time. Thank you so much, Deanna. I appreciate you being here with us. Tell everybody where they can reach you.
Yeah, so I'm just going to have you go to my website, centeredphysicaltherapy.com. It's centered with an ED. You're coming back to your center. So centeredphysicaltherapy.com. And I have a lot of information on there about the gut health and the pregnancy. And I do have a link to other practitioners worldwide, because postural restoration is recognized worldwide. There's only like 250 practitioners that are certified in the world. And but it's growing every year, and there are some that are not quite certified but have been taking many classes. So there are ways to connect with a practitioner in your area.
And people can reach out to you and work virtually on the functional medicine part, correct?
Yes.
Beautiful.
Virtual. Yep.
All right, everybody. We will see you again next week with another tip and some more great information. We've been here with Deanna Elliot of Centered Physical Therapy, and I'm Liz Larson with New Life Perspectives Radio Show. See y'all again soon. Thanks for being here with us on the New Life Perspective Radio Show. For more information or to find out more about the work that Bill and I do, please visit us at cognomovement.com or email us at info@cognomovement.com. See you again soon.